Welcome back to our last part of our tour of gram-negative diseases. So just since filming the last video, my mouse has died. Looking for a mouse in my daughter's room, I blew a fuse. So I'm just hoping I can finish this. So we're going to start off with a YouTube, and we are discussing the causative agent Bordetella pertussis and how it causes whooping cough.
Whooping cough. It's a bacterial infection that's risen to epidemic levels in some parts of the U.S. In adults, the symptoms can be mild, but if the infection is spread to a baby who hasn't yet received a full course of vaccinations, whooping cough can be very serious. Here's more on how to handle this disease.
Are you being shy?
21-month-old Pedro Escueda's symptoms started out like those of a typical cold.
He had a little runny nose and started having a little cough.
But over the next 4 to 5 days, Pedro's mom, Chelsea, says the cough got much worse.
It was nothing I've ever heard before. He was coughing and doing the whoop. He'd vomit.
And he couldn't catch his breath. When they took Pedro to the doctor, the coughing had subsided, so they figured maybe it was just a cold or some other infection. But Chelsea knew there was something else wrong. So the next time Pedro had a coughing fit, her husband got it on video. A nurse practitioner saw it and diagnosed it right away.
And she saw it, she goes, that's pertussis.
Whooping cough is also known as pertussis. It's caused by a bacterial infection that is spread from one person with whooping cough to another person.
What is he doing?
Dr. Thomas Boyce says whooping cough is particularly tough on kids younger than Pedro, who haven't had the full course of vaccinations given at 2, 4, and 6 months.
They're particularly susceptible to getting infection, and because of their small airway, they're particularly susceptible to having very severe disease.
You see, the infection happens in the airway or trachea. The pertussis bacteria produce toxins that irritate and inflame the airway. This causes the severe, repeated cough that lasts for months.
They call it the 100-day cough.
Pedro and his entire family took antibiotics to treat the infection and prevent further spread. Now he's back to health after months of illness. Dr. Boyce says babies usually get whooping cough from adults who have a mild infection. He says that's why it's important for adults to get booster vaccinations every 10 years. Ask your doctor for the tetanus diphtheria shot that also includes a pertussis booster. For Medical Edge, I'm Vivian Williams.
So hopefully that showed you that this is a disease. It's way more serious in young children. There is a vaccine for it. The thing is, the vaccine doesn't provide lifelong immunity. So they do that round of vaccines within the first 2 years of life. But the thing is, not everyone gets their booster shot. So, when your physician asks you, have you had your tetanus shot? It's included in that shot. So diphtheria, tetanus, and pertussis are all in one vaccination. So adults, which is very much more mild in them, will spread it to the infants. So part of it, the problem that why this is still endemic in our country, and it is preventable, is that the vaccine doesn't provide lifelong immunity, adults spread it to infants, and then two, now a lot of people are afraid to immunize their children, so they delay or don't give their infants that pertussis vaccination. And once again, they're just misguided by some false studies that vaccinations cause autism. Perhaps you've heard of Bordetella, if that sounded familiar to you if you have a dog, because kennel cough is also caused by a different species of Bordetella, but your dog also gets immunized against kennel cough. But the toxins from this bacteria, they damage the cilia, and so you get that sloughing and the death of the epithelial cells in the trachea. You get increased secretions, and so it just brings on the proximal, that sudden cough, and the children are just gasping, and that's where you hear that whoop. Yeah, it has 3 stages, and they just kind of defined it. I'm not going to ask you this, but it starts off as a cold. Then you have the proximal stage, like I said, where they have that whoop, where they're just violently racked with coughing spells and they're gasping for breath. And then, like I said, it takes a long time to get over it. So the convalescent stage, still coughing, just not as often. So definitely want to encourage your patients to get the vaccines, and children get a version that's going to be acellular and then toxoid, and then adults can get a vaccine that has an inactivated form of pertussis. All right, so our next one is Hemophilus influenzae. It does not cause the flu. I'll tell you why and how it got its name later. So let's watch this.
Hemophilus influenza B is a bacterial infection that typically infects children younger than the age of 5. It's spread by direct person-to-person contact or through respiratory droplets. Now normally, if your child gets exposed to Hemophilus influenza B, it just plays around in their nose and throat and doesn't cause any problems. But occasionally it likes to make a little detour through the lungs or in the bloodstream, and that's where havoc ensues. It can cause problems with pneumonia, infections of blood, bone, joints, an infection of the lining of your spinal cord or brain called meningitis, even an infection of the lining of your heart, and death. Before the vaccine, the incidence of Hemophilus influenza B that was called invasive, where it caused huge problems, was about 20,000 per year and led to about 1,000 deaths. The vaccine was developed in 1987, and within 3 years of its widespread use, it had decreased the incidence of invasive Hemophilus influenza B by 95%. Currently, we see 99% less invasive Hemophilus influenza B than what we did prior to 1987. This vaccine has been a godsend to pediatricians because this disease typically happened to small children, and it caused devastating effects. So that one, seeing your child or seeing a child die from it was awful, but seeing them live through it and live with the problems that it left, like deafness and mental retardation and seizures, were awful as well. When we get that first Hemophilus influenza B vaccine at 2 months, pediatricians as a whole take this deep sigh of relief. It's a great vaccine and it's done amazing things.
Okay, so vaccines for Bordetella pertussis and Hemophilus influenzae, they are going to be given in the first 2 months of life because both of those diseases are so very difficult for infants and for younger children. So that's why on your study sheet, there's a little icon of the baby. Yeah, I did go a little crazy. So the organism itself, so Hemophilus, it is blood-loving, so it is fastidious. It is a very short, sort of roundish rod, so coccobacilli, and it is often normal microbiota, so of the respiratory tract. And so it's usually harmless, but just like that YouTube, if it gets invasive, it can cause pneumonia, and the big thing that was killing children was going to be that meningitis, so in children under the age of 5. It can cause ear infections as well. So it's preventable by that Hib vaccine, and so it's just very important that your patients, you encourage them to vaccinate their children. And like I said, just you're going to have to be the voice of reason. It does have a capsule, so it can avoid the immune system, also forms biofilms, which help it cause those ear infections, respiratory infections. It has no exotoxins once again, but like I said, the big thing, if it's just the respiratory, upper respiratory, it's fine, but it can invade tissues, cause bacteremia, and then once again, the meninges, and this is not something that they even get over it, there's still lifelong debilitation. All right, so let's recap meningitis because we talked a few about them. So meningitis affects the central nervous system, so the brain and the spinal cord. The first one we talked about was a gram-positive, so Streptococcus pneumoniae. So it's all meningitis. The big three, they're all going to start as respiratory infections, so all through respiratory droplets. So what was different about them? Remember, Streptococcus pneumoniae is the number one. So number one cause of bacterial meningitis. And this is going to be seen in teens and adults. The next one we talked about, gram-negative, so Neisseria meningitidis, the only gram-negative cocci to cause disease. Once again, respiratory system, okay? In this case, what did we say that was special about this one? It is more deadly than Streptococcus pneumoniae meningitis. So more people, even with treatment, die. Other things we said about it is that this is the only meningitis with a rash. And then 2, Remember, this is the one that causes epidemics. So this sort of just crops up usually in the early part of the year in the United States. And so amongst the crowded young, so adolescents and young adults, so in dorm rooms, military barracks, and then of course children if they have not received their vaccination yet. So it's another one. So this is protected by a vaccine. This is also by a vaccine. So because meningitis causes death, we're always wanting to have a vaccine against that. And then now we just layered on Hemophilus influenzae. So what was special about that one? Yeah, so infants and young children, that is who it's going to affect. It's mild in adults. And so, once again, the vaccine. Streptococcus agalactiae and Escherichia coli. I just mentioned this one, but both of these, if you look over here, so neonates means a newborn. So these are going to all be vertically transmitted as the baby exits out the mother's vagina. So these are common residents. Listeria monocytogenes, we talked about that one because that is the only foodborne cause of meningitis out of all of these. And so that was that psychotrope, the Bluebell ice cream recall, but usually it's on cold cuts and it can be on other foods. It can affect pregnant women, the elderly, so the immunocompromised, and then it can cross the placenta and also will affect the babies. So that is the tour of meningitis. Remember, just kind of key on the things that are special. I've helped you with your icons, hopefully, and with your Quizlet. We have one more to go. So last one, the causative agent is Yersinia pestis, and this causes the Black Death or plague. So there's two types of plague. There's bubonic plague, and it got its name because the symptoms, or what's happening, is that this bacteria will infect the lymph nodes. And so the lymph nodes become swollen, and then you have necrotic tissue, and then they looked black. So the places where they are superficial, so in the inguinal region, axillary region, and the cervical region, the people that had it were scary to look at because you just saw this necrotizing tissue. So that's where the black plague came from. The other type is pneumonic plague, so pneumonia affects the lungs, and so that's an infection of the respiratory system. How someone gets either bubonic plague or pneumonic plague, this particular bacteria is endemic. That means it's just there, you're not getting rid of it, in rodents. And so rats mostly, but also prairie dogs. So we've had some transfer to the United States. There's usually about 20 cases in the US per year. But the fleas bite the rodent, and then the fleas bite the human. So that's how you get bubonic plague. Once that spreads to the lungs, then a person that has the plague can then, through respiratory droplets, through airborne transmission, give somebody pneumonic plague. And so the virulence factor, just kind of showing you that mobile genetic element, is going to be on a plasmid. And so yeah, so transmission, like I said, pneumonic plague, inhalation. This is the one that has been used throughout history, and it's also just a concern because it makes a great bioterrorism agent. Incubation period, very, very short. Fever, malaise, respiratory problems 1 day later. Yes, you could be dead in 2 days. Higher mortality rate, greater than 90%. The bubonic plague, like I said, you're going to get that from an infected flea bite. We're seeing it because people like prairie dogs and keep them as pets, so that it's also a reservoir other than rats. Incubation period's a little long. You get a fever, you get those buboes, like those inflamed lymph nodes. Also, it can affect the eyes, conjunctivitis. It can go in the blood, and that's how it'll spread to the lungs. It too has a very high mortality rate, not as high as pneumonic, but very high. So this is the plague that wiped out at least half, a third, or a quarter, depending upon which history book or textbook you're reading. It did wipe out about 20 to 30 million people in Europe between 1347 and 1352. And so my last parting gift to you on this unit, actually my daughter shared this with me, yes, all about the history of Black Death and Yersinia pestis.
It's the plague, gonna kill you in a few days. A pandemic so severe, Black Death caused such horror and fear. And there ain't no cure for that, girl. You'll be dead in no time flat, girl. You get acronecrosis from the Yersinia pestis, and it makes your tongue a black, girl. Gonna bury you out and back, girl. Ooh, fleas on rats, fleas on rats. 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 Started in China, don't know how, but the Mongols used biological warfare. At Kaffa, hurl plague corpses at the Genoese. The Italians fled back to Sicily, and in 1347, Black Death said hello to Europe in the form of infected fleas. From port cities along trade roads, buboes swelling in the nose, and it spread real fast like that, girl. Better flee when you see a rat, girl. People living for the now, bro, like the book by Boccaccio. Or you could be a flagellant, girl. Flog yourself till you repent, girl. Ooh, fleas on rats, fleas on rats. 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 5 kilometers a day, and in 5 years killed 2/3 of the population. Some blame the lepers or Jews, did the poison the wells. It led to peasant revolts, loss of faith, and some serious persecution. People carried pouches of herbs to protect them from the smell. Doctors didn't know what caused it. Bolt your door if your family's afflicted. Bodies in the carts, girl. Skeletons in the art, girl. With a decreased population led to the amelioration of the peasant folk. Hey, they could ask for more pay. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats. Let me hear you say, this plague is bubonic. B-U-B-O-N-I-C. 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 A pandemic so severe, the Black Death caused such horror and fear, and there ain't no cure for that, girl. You'll be dead in no time flat, girl. You get acronecrosis from the Yersinia pestis, and it makes your tongue a black, girl. Gonna bury you out and back, girl. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats, fleas on rats.
And with that, I am done. This wraps up my last video, thank God, just before my computer is going to die. Hey, guys, have a great day. As always, if you have questions, I'm here, and see you soon.